Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady. Today we're going to be speaking to Dr. Landrum of the Landrum ENT in Ada, Oklahoma. Dr. Landrum is board certified in Otolaryngology and head and neck facial plastic surgery. Dr. Landrum received his specialty training in head and neck facial plastic surgery from Philadelphia College of Osteopathic Medicine. Welcome, Dr. Landrum.
Thank you very much, Michael.
Dr. Landrum, please tell our viewers a little bit about yourself and your practice in Ada.
Well, I am originally a native Adan. I'm born and raised in Ada. My family's been in this part of the state since before it was a state. I got some of the best training I could up in Tulsa and then moved to Philadelphia for my residency ear, nose, and throat training. Some of the best training I could in the country. When I was done, I had the option of going anywhere I wanted, but Ada was home, so I came back to Ada.
Dr. Landrum, could you tell our viewers what exactly is an ENT doctor?
Simply put, ear, nose, and throat are the big things that we concentrate on, but really we deal with anything from the neck and above, with the exception of the brain, the spine, teeth, and eyes. That can be everything from the sinuses to the ears to skin cancers to throat cancers, voice problems. It can really be just about anything in this area we deal with the exception of those four things.
Dr. Landrum, how long have you been an ENT doctor?
I've been in practice in Ada for 2.5 years now. Before that, I did my 4 years of residency, and a couple of more years before that. I've actually just finished my 10-year reunion from medical school, so I've been a physician for 10 years now, but doing the ear, nose, and throat part of it has only been for the last 6 years, 2 of which have been actually practicing on my own here in Ada.
Dr. Landrum, as an expert in the field and someone who's been in practice for many years, especially in Ada, what advice would you give someone that's looking for an ear, nose, and throat doctor in the Ada area?
First of all, want to make sure board certification. The board certification shows that you have gone through a certain level of training, a certain number of years of training, and were able to pass boards exams that were specific for ear, nose, and throat. It does not guarantee, but it gives you at least a knowledge that you have a good trained surgeon, a good trained physician who knows his material and at least has that certain level of training, which is in this country a very, very high level of training. Beyond that, you really want to make sure you find somebody that you get along well with. Ear, nose, and throat, unlike a lot of surgery, you spend a lot of time with that doctor. A lot of surgeons, you'll see them once before surgery, once after. Ear, nose, and throat, you tend to have a lot more ongoing relationships, and it was one of the big things that attracted me to ENT. If you have an allergy patient, you may see that doctor every week for years. Even if you have a cancer or something as simple as having tubes in your ears, you will be seeing that doctor on an ongoing basis for months or years. So you want to make sure it's somebody that you get along well with and you like.
Well, let me ask you, as a board-certified surgeon, and of course a leading physician in your field, in your opinion, what's the most important thing that a patient or prospective patient should be looking for in a positive surgical outcome or result?
First of all, we talk about board certification. That is important. Make sure you have somebody that is, beyond that, is well respected in the community. Speak with the nurses that work with him in the hospital. Speak with people that work in the operating room. Ask other surgeons, other anesthesia that you may know, any physicians you may know, about what their real surgical skills are like. It's great to have somebody that is likable. It's great to have somebody that you enjoy seeing, but you also want to make sure that you have somebody that does have capable surgical skills. And that is sometimes easy to find, sometimes not so easy to find. But ask around, ask questions, ask people that may know him.
All right, I see. Well, let me ask you a little bit more specifically now. As an ear, nose, and throat doctor, what's the most common procedures you're currently doing?
By far, the most common procedures are going to be tubes and tonsils. Tubes are actually the most common surgery done in America, and tonsils are a not too distant third most common surgery done in America. They are something that are done very commonly, very regularly. They're also something that are done on kids, which gives a whole new level of anxiety for parents, because quite often you have small children that haven't undergone surgery before. So it does have a level of anxiety for the parents, but it's a very common surgery that we do a lot. Also do a considerable amount of allergy practice that includes sinus surgery, allergy shots, but it can certainly include things like vocal cord surgery and neck and head and neck cancers and skin cancers.
Just for clarification for anyone that might be watching this interview, could you kind of clarify for us, what do you mean by tubes? I think everybody pretty much knows what tonsils are, but they might not know what tubes are.
Tubes, if you have usually a child, but we certainly do tubes in adults, ear infections, frequent ear infections, put a small tube into the eardrum. That allows any fluid to drain out in an equalization of the pressure inside the ear and outside of the ear. That helps prevent future infections and all the problems that you can get from frequent ear infections and constant fluid in the ears. It's most commonly done on kids, but we do them to 90-year-olds and 9-month-olds equally.
Well, because it's very common with children, probably because of swimmer's ear and that sort of thing, can you kind of talk through the process? What kind of pain is involved, and what's the recovery time?
The recovery time is really pretty minimal. If it's an adult, we actually do it right here in the office. I'll put a little drop of numbing medicine on the eardrum. It does burn, but just for a second, I'll make a small incision in the eardrum, place that tube. If it's a child, you can't expect a child to hold still, so that's why most tubes are done in the operating room. A little bit of gas. Usually there's no IVs. Usually there's no tubes in the throat. We'll just make the incision, pop that tube in. The surgery itself takes less than 2 minutes. It actually usually takes longer to clean the earwax out of the ear than it does for the surgical portion itself. Very quick surgery, pop that tube in, and done. There may be a little bit of discomfort that day. Usually just some Tylenol can take care of it. Most of the time, by noon, the patient never even knows they had anything done.
Dr. Landrum, I know that is very valuable information for our viewers. Next, I would like to ask you, if someone was looking for an ear, nose, and throat doctor and they came to your practice, can you kind of talk to our viewers, what's the experience like from the time they walk in the door?
First thing is you're going to have a friendly staff. I've worked to have a nice office, a friendly staff, and somebody's going to greet you from the word go that is going to give you a smiling face. You're going to be escorted back into the room, and most of the paperwork will be done on tablet computers. Simple yes-no questions will help me know what's going on and what other problems you have had in the past that we'll need to worry about. But everything will be done. Friendly is going to be one of the big keys that we're going to have. My entire staff, we have groomed them and we have hired them large extent based on just their disposition and be able to give you a friendly smile, a friendly face, and make a very awkward, uncomfortable, sometimes even painful experience a little less painful than it otherwise would be.
It sounds like a very pleasant experience, and I know that you're a very thorough doctor, so I'd like to thank you for being on this interview and sharing a lot of very valuable information with our viewers.
I'm glad I could help. If there's anything else, then I'll be more than happy to help in the office or wherever.
Again, thank you very much.
Thank you very much, Michael.
My name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking to Dr. Trey Landrum of Landrum Ear, Nose, and Throat in Ada, Oklahoma. If any of our viewers would like to get more information from Dr. Landrum, please refer to the phone number at the end of this interview. Again, Dr. Landrum, thank you so much for the information.
Thank you very much, Michael.